So good evening, everyone. Uh, we welcome you today and our webinar number 3 for the Road to Optometry, which is sponsored by Latinos in Optometry and Transitions Optical. And we are so excited that you are here today joining us. And today is a really special day for me because we have an amazing guest that is special to my heart because he was my professor when I attended optometry school in Puerto Rico. So you're in for a treat, and we're going to have so many enlightening moments today, but we do want to be respectful of your time. So this webinar will go on for a total of 45 minutes. So if you get a question in the middle of the interview, feel free to put in the chat, or if the chat is not available, to send a message to one of our hosts or panelists, and we will answer them. And if we don't answer them here, we will absolutely answer them in a Instagram Live or Facebook Live in the future. Now, today's guest, like I said, is special to my heart because he was my professor in the School of Optometry in Puerto Rico when the school, at the actual OG school, when it was in Atorrey. So it was a while ago, but he is still a professor there. And today we will be interviewing him, and it's very, very exciting. So my name is Dr. Diana Canto Sims, and I am the co-founder of Latinos in Optometry. I'm also on the diversity board for the Vision Council and for Transitions Optical. And today we want to share with you an amazing interview for our third Road to Optometry webinar, which will be the career of academia. So we already did webinar 1 and 2. So go ahead and check those out when you're done here. Webinar 1 talks about, is private practice the career for me? Webinar 2 is from my amazing board member and amiga, Dr. Glenda Aleman. And that webinar is about myopia management and working in corporate. So if those are two modes of practice that are interesting to you, go ahead and check out that webinar. But today, we're going to talk about academia. Maybe you've always felt it in your heart to teach. Maybe you've always wanted to learn more and do maybe case studies. And today, we have the perfect person to ask all of these questions. So we encourage you to actively participate in this webinar, to ask questions, and we will do our best to answer them today. And now I want to introduce my co-host, my amiga, my fellow board member. So Dr. Glenda Aleman is also a board member. She is a dear friend of mine. I call her the myopia management diva and queen because she is so knowledgeable. Again, go check out webinar number 2 so that you can hear all about Dr. Glenda Aleman. Dr. Glenda, the stage is all yours. She's going to talk to us about Latinos in optometry and what we're all about and what's happening. Glenda.
Gracias, Diana, and welcome everybody. Hola, bienvenidos. And thank you so much, Diana, my dear friend, for the wonderful introduction. So what I want to talk to you about is the mission of Latinos in Optometry. So the mission of Latinos in Optometry, as the leading voice for Latino eye care, we provide education, mentorship, and leadership to better serve the Latino community. Our vision is to increase the number of Latino optometrists and empower the eye care community with resources to better serve Latinos. So as you may or may not know, there is a huge gap between the Latino population and the actual percentage of practicing Latinos optometrists. And this is the whole purpose of Latinos in Optometry, is we want to lessen that gap. That's why we're doing this, to get more students and more Latinos to become optometrists, enjoying this wonderful profession. So our goals for Latinos in Optometry is to increase the numbers of Latino students in the optometry schools. We want to provide resources and communication for Latinos in optometry, provide resources and communications for the eye care community. So what that means, it sounds like it is the same as the previous goal, but it's different because that goal is for us to provide resources to the non-Spanish practicing OD. So some of these you might be in a community that is heavily populated by Latinos, but you might not speak the language. So in the future, we are working really hard in the backstage to create resources to help you if you happen to be in a population heavily Latino, but you are not speaking Spanish. So that's one thing that we are working on creating. We also want to be the conduit between the Latino community and the eye care industry. And lastly, we want to provide CE. So these are going to be courses that we will be providing again to our colleagues in the industry about cultural competency and the importance of being all inclusive and catering to the Latino community, because as we all know, we Latinos are very lively and we have very different and unique needs. So tonight we always pair our wonderful doctors, ODs, board members with an amazing student. So our student for tonight, who is going to be conducting the interview with Dr. Hector Santiago, is Liliana Gonzales. So Liliana is originally from Miami. Liliana's passion for optometry began in high school when she worked as an optician in an optometrist's office. It was there that her curiosity for the profession grew, and Liliana later graduated from the University of Florida with a bachelor's in microbiology and cell science and a minor in health disparities. So a very smart little young lady here. And sorry for the little young lady, but I mean it with, my most deepest sentiment. And she also, during her time as an undergraduate student, became the president of the pre-optometry club at her university. So Liliana is in her first year of optometry school, and she is a student at the Indiana University School of Optometry. Mm-hmm. So welcome, Liliana. She is already a leader. So we are so glad to have you and help us conduct this interview tonight. So Liliana.
Thank you so much, Dr. Aleman, for that lovely introduction. And I am so glad to be here with all of you today. As mentioned, it is super important to get our Latino numbers up in these classes. I currently am one of 3. That's really low here in Indiana, and our goal is just to keep pushing that number up and just raise awareness of Latinos in optometry. So without further ado, it is my pleasure to introduce today Dr. Hector Santiago. And I'm going to start off by giving a little bit of background on Dr. Santiago, and then we will continue on with our interview. So Dr. Hector Santiago was born in Ponce, Puerto Rico. He obtained his bachelor's degree in physics and mathematics from the University of Puerto Rico, his master's degree and PhD from the University of Texas Graduate School of Biomedical Sciences at Houston, and his Doctor of Optometry degree from the New England College of Optometry in Boston. He has been involved in optometric education for 39 years. He was Dean of the Inter-American University of Puerto Rico School of Optometry and founding Dean of the Midwestern University Arizona College of Optometry. Dr. Santiago has more than 100 publications, posters, and lectures. He has been an invited lecturer in 12 Latin American and European countries. He was a member of the ACCO's Cultural Competence Guidelines Committee, delivering training on cultural competence teachings at many schools and optometry colleges in the U.S. He directed 22 humanitarian clinical missions in Latin America, where more than 15,000 patients received free eye care, eyeglasses, medications, and even surgeries. He received the Brian Holden Humanitarian Award from the American Academy of Optometry in 2022. He was named Ambassador of Goodwill, the highest distinction of the Lions Club International. He is a fellow and diplomat of the Public Health and Environmental section of the American Academy of Optometry. Dr. Santiago is currently the president of the VOSH International and a board member of Latinos in Optometry. He is a professor and director of research at the Inter-American University of Puerto Rico School of Optometry. Dr. Santiago's lifetime interests include optometric education, development worldwide, cultural competence, public health, pediatric optometry, optometric research, and clinical humanitarian services. He believes that students' active involvement with the community they serve promote the highest level of professionalism and lifetime learning. Wow, very impressive, Dr. Santiago, and we are so excited to be able to chat more today about your various roles and experience. So to get us kick-started, I'm going to ask you the first question, and that is if you could tell us more about your path to optometry and becoming a professor at a school of optometry. So take it away. Thank you so much.
Thank you, Liliana, and thank you to my fellow colleagues, Latinos in optometry, and thank you so much to everyone who's here tonight. Let me talk a little bit about me, not because my life is particularly important, but because it will allow me to pinpoint some points that I believe are very important. As Liliana mentioned, I am from Puerto Rico, from Ponce, Puerto Rico, born in a poor neighborhood and a poor family. And I always remember my mother that kept telling me the importance of studying. And I assume many of you are students, eventually you will be parents. And the first point I want to make out is that as future parents, you can make the difference in the life of your kids by promoting learning. Many of us come from socioeconomic backgrounds that are disadvantaged, but the big equalizer is education. So very important as future parents to think about that. When I went to high school, I was part of a program sponsored by the Ford Foundation. And in that program, we had university teachers, university professors coming to us in high school. The very best, many of them had written books. One was a laureate. But I always remember being there, wow, one day I want to be like one of them. These are top-notch professors, which brings us to my next point. As a teacher, you can inspire others, your students, to excel. And I hope that one of the reasons some of you go into the academy is the opportunity to inspire students to excel themselves. Well, when I was in high school, I had my first eye exam. I was a myope. And I remember going to the optometrist, and I was very impressed with his ability to measure refractive error, intraocular pressure, the curvature of the cornea, the amplitude of accommodation, all the equipment. And I remember talking to him. I said, well, what do you like? Would you like to study when you go to university? He said, well, I'm interested in physics and mathematics. And he said, you know what? A good part of optometry is geometric optics, physical optics, ophthalmic optics. Why don't you think that maybe you consider optometry as your future professions? And it brings me to the next point. Eventually, you'll be optometrist, and you can be the inspiration and promote in many of your young patients to go into optometry. You're ambassadors of the profession. Actually, I know because I used to be dean that we figure out that the best ambassadors and promoters of the professions are the optometry themselves. Well, I went to university. I obtained my bachelor's degree in physics and mathematics, but I wanted to do more. So I decided to go to Texas and to obtain my master's and PhD. That was the first time I ever got out of Puerto Rico in the mainland. So here I am, Puerto Rican, poor background, with very unpolished English. And I decided to go there, no friends, no family members, but I wanted to take that risk, which brings me to the next point, which is very important. In order to succeed, you got to take risk. You should be willing to put yourself to the limit. No important accomplishment occurs without a big effort. So I went there. My work in my master's was related to contrast vision in pigeons, and my PhD, my doctoral science degree, my thesis was related to visual recognition memory in humans, monkeys, and pigeons. So along the way, as you can imagine, I learned a lot about the eye, and I learned a lot about vision. And just the words of my optometrist were still back there saying, I learned a lot about the academics, the theory behind vision, but maybe I can do more. Maybe I can apply that knowledge to the clinic. So I decided to do an optometry degree, OD degree, at the New England College of Optometry. I remember I wanted to finish in the summer. So for almost a month, I only slept 4 hours a day. I was running experiments. I was writing my thesis. And again, when you really want to do good things in life, you have to be able to sacrifice yourself for it. I went to the New England College of Optometry, which is my alma mater. I did my degree in 2 years because they have an accelerated program. So at the end of those 2 years, I had to ask myself what I'm going to do for the rest of my life. It turns out that in Puerto Rico, they had just opened a new school, Inter-American University of Puerto Rico School of Optometry. I said, that's exactly what I would like to do. I want to spend the rest of my life to optometric education. And Dr. Arthur Afanador, which was the dean, offered me the opportunity to be assistant dean for students affairs and as well as teaching. So I was part-time teaching, part-time administrators. Eventually, through time, I became dean of the school for 12 years. And as you mentioned, I had the opportunity to be founding dean of Western University, Arizona College of Optometry. So I think in a nutshell, a little bit about me, again, because I wanted to pinpoint that all of you can do the same or even more, but you have to feel the passion. You got to be able to take risk. You got to be able to listen to your optometrist and to listen to your heart as well as to your brain.
Thank you for that response, Dr. Santiago. I really liked what you said about risk-taking, because that is similar to my situation right now, moving away from home for the first time and being out here on my own and doing school. It's all about those risks. So moving on, what should we do if we are looking to pursue an academic career? Can you give us a little bit of insight on that?
I think the main thing, obviously, is that you have to enjoy teaching. And obviously, not everyone does enjoy teaching, but I believe that everyone else has a little bit of the passion to teach somebody about something. And now, in terms of your own preparation, if you want to go into clinical optometry, supervision of students, my recommendation is that you do a 1-year residency program. And there are many residency programs in all kinds of areas, contact lenses, pediatric optometry, vision therapy, low vision, hospital-based optometry, primary care optometry. But that opportunity to do a residency program would sharpen your skills in a very specific area. And it will give you an opportunity, an easier opportunity to get into an optometry school. If you're more bent into the academic area, perhaps my recommendation is to do either a master's and or a PhD, because by doing that, you'll learn a lot about doing research. And a good part of it you will be doing as a professor is doing research, writing manuscripts, and publishing manuscripts. So my recommendation is to do one or both, either go do a residency program or go into a graduate program. You don't have necessarily to have that, but it will give you an advanced step. It will increase significantly your chances of being hired by a school or college of optometry. I must say, unfortunately, there are not that many Latinos into academia, and I hope that's changed. Even though we are 19% of the US population, we are less than 8% of students and about 5% of faculty members. There's a big gap. And I hope that through Leo and the work of you students, we change that reality.
Could you expand a little bit more about the advantages and challenges of an academic career?
Okay. Advantages. I think what I will say is the opportunities. One of the things that going into academia, if you enjoy research, is exactly that, the ability to do research. When you're a clinician, you apply that knowledge your skills to a single patient or a group of patients. When you do research, you're finding new evidence, and that evidence hopefully will change the way you practice. To give an example, just a few years ago at the school, we did a study of more than 3,000 kids in Puerto Rico. And we found through that study, which is a study of the prevalence of refractive error, that 1 of every 5 kids in Puerto Rico is myopic, 21%. Our colleague from the school, Dr. Neisha Rodriguez, found that during the COVID epidemic, there was an increase in the myopia of children also, for obvious reasons. Now we know, and Dr. Glenda just gave a presentation of myopia. We know that half of the world population will be myopic by 2050. Nowadays, we know that we have techniques to decrease the progression of myopia. And I'm sure Glenda mentioned things like multifocal contact lenses, orthokeratology, low dose of atropine, special eyeglasses. So we now know that we can control myopia progression control. Now, because we found that many myopes in Puerto Rico, we know that by 2050, there'll be around 200,000 Puerto Ricans at the risk of glaucoma, at the risk of retinal detachment and cataracts, because high myopes are at risk of those conditions. So just recently, about last week, I wrote a column in the paper calling up for legislation to require that every kid in Puerto Rico should have a comprehensive eye exam. So this is an example of research you do that may impact policy. And that's an opportunity that as a faculty member you have, doing research that will make a difference in the way we practice. I think the other thing that is obvious, I believe, is that as a clinician, you examine a patient and hopefully you make something good for the patient. Sometimes you make difference in the life of the patient. When we teach, you multiply yourself on every one of your students. As Diana here, I feel very proud to have been his teacher. We multiply ourselves in the work of our future optometrists, our students, and then will impact hundreds, if not thousands of patients. That's something that you can do in education. No other professions allow you to have that kind of impact. And lastly, I think it's kind of a more subjective thing, is every faculty member have great satisfaction as we see you flourish. The greatest satisfaction that a faculty member has is to see each one of you become optometrists and doing the good, promote community serving, and serving each one of your patients. Challenges? Okay, let me talk about challenges. One of the challenges that is obvious to you, Liliana, will be more obvious next year and the year after, because you're in your first year, is very hard to keep abreast of the new evidence. We know that in 40 years, what we teach today, 50% of what we teach will be false. So for us, as faculty members, it's a crucial job to keep abreast of what's changing. We have to read journals, we got to go to the academy, we got to take continuing education courses to keep abreast. By the same token, another challenge is how the responsibilities of the profession has changed through time. The first TPA law was in 1976. That was 46, almost 50 years ago. And I remember going to school, just we had a few states with TPA laws. Now every single state have a therapeutic laws. In many states, you can perform some kinds of surgeries. So for us who are more clinical oriented, it means that we have to keep abreast of those changes. So I would say those two are big challenges for every one of us who are in the teaching profession. Keeping abreast of the knowledge, keeping abreast of how optometry is changing clinically.
Thank you for shedding light on those things that we might not hear every day, especially as students going through the program, because as you know, academia or the academia setting isn't really talked a lot because we're mostly focusing on becoming the clinicians and preparing to see patients and not as much the academic side. So thank you for that insight. And then lastly, as president of VOSH International, could you shed light and tell us a little bit about the importance of volunteer humanitarian work and more about VOSH International as a whole?
Sure. I'm very happy to be a member of Bosch, president of Bosch International. Bosch International is the largest volunteer optometric organization in the world. We have more than 100 chapters across USA, Canada, Latin America, Asia, Africa. And every one of those chapters, the main impetus is to provide eye care to disadvantaged communities, to underserved populations. I myself have had the opportunity to serve in over 25 humanitarian clinics, mostly through Latin America. And with my fellow students and with fellow colleagues. And the emotion, the satisfaction you get through serving is kind of unique. And I think it represents the very best that optometry can offer. I think that we are doing is responding to a challenge that an extraordinary woman, she was deaf and blind, presented to us in 1925. That woman is Helen Keller. And Helen Keller said to us, I challenge you, those who can see, those who can hear, those who are brave of heart, why don't you become knights in the crusade against blindness? And that's exactly what inspired every optometrist in the world. The opportunity to be the difference. And for those people who have visual impairment, and hopefully avoid blindness. So in short, Bosch represents the essence of what optometry is all about. And I hope that many of you people who are in schools, please be a member of Bosch or S-Bosch, student Bosch chapters. The opportunity to do humanitarian work at the international level will change the way you think about your profession. And it will value what you do, the ability to make the difference of many people. We just 2022, we went to Panama to examine about 900 Guna Indians. It was the first time we worked with students from Panama. And it was a big challenge because many of them didn't speak Spanish. Yet we found that more than 40% of them were visually impaired. We were able to provide eyeglasses. We were able to provide referrals for surgeries. And the ability of us to do that makes all the difference too. So in a nutshell, if you get an opportunity, become an S-Bosch member. That's my recommendation.
Thank you, Dr. Santiago. That was it made me excited to join VOSH, my chapter, and looking forward to the trips that we have coming up too. So thank you for that. And with that, we wrap up our Q&A session. Thank you so much for taking the time to speak with us and shed some more light on a career in optometry, but not only optometry, but also an academic setting within optometry. And with that, I will hand it back over to Dr. Diana Cantos-Sims to wrap us up. Thank you so much, everyone.
Thank you. Thank you so much, Dr. Hector Santiago and Liliana. This has been very, very insightful. Thank you all for joining us today. We hope you found this webinar informative and valuable. Remember that knowledge is power, but also action is truly what's going to cause change. And today we want to go over a couple of points and questions. So if you do have questions, make sure you use the Q&A in the chat to ask your questions. You can also ask any questions in the chat that you may have for Dr. Hector Santiago. In the meantime, I'm going to go over a couple of points that we touched today. Remember that in order to succeed, feel the passion, and then you have to take risks. right? Nothing happens until you take risks. And also step out of your comfort zone, right? Because that is where the magic happens. And we've seen that here today. Also, some of the advantages and the opportunities that you have if you go into academia is the opportunity to do research and really make a change and be able to have surveys and evidence to be able to make change. For example, the survey and the research that Dr. Santiago did in Puerto Rico, where they have this information about myopia, and this is very insightful information so that we can be proactive, right, with the entire island of Puerto Rico and know that there is a myopia epidemic in the island and we will do something about it. So if you want to create change, academia is absolutely one of the careers and modes of practice that you can take to make change. So we do have some questions. Says, how can we get involved with SBOSH and BOSH? If there is a link or something you can share, because we are very, very interested.
Yes, thank you so much for that question. I love it because it's very easy. Just go to our website, Bosch International, and right there you'll find all the information you will need. It's very easy. You establish a group, a board of directors, if you will, and then send an application. You'll be asked about information about the School of Optometry, very basic information. That's it. And all we require is that you not only become a member of SBOSH, but you do something. We want you to go out into the community and do the good work. If you go to our website, every year, there are 40 to 50 clinical humanitarian visits, missions from the US into Latin America. You can be one of those. You can make a difference. So very easy. Go to Bosch International website, bosch.org.
And Dr. Santiago, can you share one more impactful story and experience that you had attending one of your Bosch events?
I guess I can share many, but let me have two.
Okay.
We went to Dominican Republic, a little town called Pedernales. Pedernales is at the border of Haiti, very poor town. A young woman came to us. She drove 4 or 5 hours to see us. And it happens that in our group was Dr. Juan Vasquez, who's specialist in prosthetic eyes. She had a prosthetic eye that was very badly fitted. Actually, it was coming off. It turned out that I have asked him, why don't you bring some prosthetic eyes to the clinics? It turned out that we found one that perfectly fitted her. Well, it changed completely her outlook about life. It's interesting because cosmesis is important. And she was able to complete her bachelor's degree. She became a teacher, and we can see her on Facebook every week. And just recently in Panama, as I mentioned, we went 2022. There was this little young Guna girl has very poor vision. We found that she had congenital cataracts, where we refer her for cataract surgery, as you can imagine, that make all the difference in the life of that little girl. So those two stories that shows the impact what we do. And of course, when we went to Panama, every patient that required eyeglasses, we were able to provide them. Because the other thing that I should mention, nothing is done alone. You got the support of foundations like Optometry Giving Sight, One Sight Exiloluxotica, as well BSP, and Lions International. You'll find a lot of people willing to work together to do the good. And so every single humanitarian clinic we do, we not only we examine, we provide the means for people to be able to see, or if they need cataract surgery or glaucoma treatment, to be able for them to get that. And the other thing that typically students find out, and I did a little qualitative studies of some of their essays, is the feeling of gratefulness. We take for granted much of what we have. And when you're able to see not relative poverty, but real deep poverty, you understand the difference of what we do can make. Why having eyeglasses, being able to see, being able for kids to study, to see. One thing that we found out that kids, Guna kids, have a high prevalence of astigmatism. 2 diopters or more of astigmatism. So you can imagine how difficult for these kids is to learn, to able to provide eyeglasses so they can learn. The difference they can make in the productivity of people so that they can become independent. That's part and parcel of what optometry is all about.
Absolutely. Dr. Santiago, I have to let you know that the chat is filled with your admirers. There are hearts, there are love. You have a base of fans here in our webinar. So just wanted to let you know that. So everyone, Latinos in optometry, thank you so much, Dr. Santiago, for sharing with us. If we have any other questions, please make sure you write it in the chat. Is there a question? No. If not, then we want to thank you for joining us today. Latinos in Optometry is your hub for resources for you to be successful in your journey towards the road to optometry. We want to make sure that you connect with us. So connect with us. We are, make sure you check out our website. Make sure if you haven't had a membership, if you're not a member yet and you're a student, membership is free for students. So make sure that you go on our website and you become a member. We are also on Instagram, we are on Facebook, and we are on LinkedIn. So if you are not on LinkedIn, this is your wake-up call as a student. It is important as a student that you start opening your doors and you start networking, even if that is virtually, right? Maybe you're too busy right now as a student to network in person, but you can absolutely open your LinkedIn account, connect with us at Latinos in Optometry. We would love to hear from you. Send us a message to let us know what you thought about this webinar. Remember to check out the previous webinars, which is private practice, the career for you, which is webinar number 1, and webinar number 2, which is myopia management and corporate. So stay connected with us. We will have our next webinar on March 6th. So make sure you go to our website and you register there. We also will have a raffle. Yay! Who wants Starbucks gift card? Who doesn't, right? So at the end of this webinar, we will have a survey because it is important to us to hear from you. What did you learn? What do you want moving forward? And when you answer that survey, you will be entered into a raffle for a Starbucks gift card. So stay tuned in your email for that survey. We are so happy to have you here with us today. Thank you to Transitions Optical, Latinos in Optometry. Thank you to all of our board members. Thank you for everyone here. We hope to see you in person someday. Stay tuned. We love you so much. Bye-bye. Adios. Hasta luego.
Diana, wait.
Yes.
Wait.
Oh, okay. Sorry.
Yes, so we have I have one of my opticians here. So a couple of weeks ago I went to my Walmart and he was like, Dr. Alleman, I want to talk to you. So he's an optician, Nick, he's here. So welcome, Nick. I'm so glad you made it. And he's like, I want to talk to you about something. And Nick is thinking about becoming an optometrist. So we already have the previous optician, Michelle Castro, who you know is the student president at the Nova Latinos and Optometry. She was from the same Walmart office. So I have 2 already now that I have recruited since we started. So I am so happy that you made it, Nick. So I just wanted to give him a shout out because, you know, a lot of times people ask for advice or something, but they don't take action. But the fact that you made it here, you know, it lets me know I'm so proud of you because it lets me know you're really serious. And so shout out to you, Nick. Just wanted to say welcome.
All right, ladies and gentlemen, thank you so much for joining us. Have a great evening. Hasta pronto. Adios.